Hi, my name is Cathy Woffendin. I'm one of the 5 staff governors here within the organisation. I'm also the Deputy Director of Nursing, Children and Specialist Services as well. I think the annual plan for staff, it's a clear vision. It sort of identifies what the priorities are for the next 12 months, and it allows to take staff on that journey really and sort of allow them to understand that more strategic, wider context. I think what the plan also does is it allows each business unit to identify its objectives and its priorities, and then it allows staff to link in their professional objectives into those wider plans as well. So it's like for you as a district nurse, what does that mean for me? How do I link into that wider context really? I think what the plan also does is it's really good at actually acknowledging how challenging it is to actually work in the NHS today. Because of all the cost savings efficiencies, but not just within health, within the wider partnership agenda really. I think staff are fully aware that we now work in a very different environment. We need to be very competitive because a lot of services go out to tender. So I think as an organisation and a group of staff, we need to consider is what are our real strengths, what do we do really well, and what can we actually make a difference with really. And I think I would really urge staff to become more familiar with some of the vanguard work, because I think that's a really exciting opportunity to do things differently and make a real big impact much wider than just within the organisation or Bradford, but on a much wider system, West Yorkshire level really.
Hi, my name's Liz Howes. I'm one of the staff governors. We all know that jobs can be quite tough at times on a daily basis, so it's important for us to help and support staff achieving their work-life balance. I know that the Trust has done a lot of hard work in this area, and I know it's a priority for this year too. As a staff governor, I listen to the views of staff members and help and support them, but we also have governors that go out into our local communities. It's important for us all to work together to support the staff and to deliver these plans for next year.
For me, they're like the golden thread that fits through the plan. I think the quality goals sort of for staff are the reason why we get up in the morning. They reflect the reason that we want to come to work, because we want to make a difference to the people that we care for, and I think that's really important that we never lose sight of that. For me, I think the quality goals are really realistic, they're very achievable, they're easy to understand, and I think all members of staff should be able to link them into their everyday practice. I think this year has been extra special really, working with the new Council of Governors for the first time around the quality goals, and I think it's been really interesting understanding from their context and having a fresh pair of eyes, and I think that's really added value.